about Stroke Awareness Month. I'm with Dr. Mark Murray, and he's with St. Anthony Hospital in Centura Health. And he's going to give us, the signs and symptoms of a stroke, talk about stroke, all in a minute. But first, I want to let you know that this is Health Happens. It's our show we do every Tuesday at 11 here on Facebook. And last week we talked about reading your 9 Health Fair results. So if you got your results in the mail and you're having trouble reading those, go to 9healthfair.org or watch our Facebook Live at the 9 Health Facebook page. And there's kind of some questions and answers on there about how to read your results. But today we're talking about stroke. And a third of Americans don't even know the sign of a stroke. I think I put that in the post. So let's start there. What are some of the signs that either you or your family member or someone next to you is having a stroke?
Well, and as we said earlier, it's so sad because all Americans can tell you what a heart attack feels like, and they can tell you all those signs and symptoms, but stroke, not so much. So we like to tell everybody to think of FAST. So FAST is the acronym, and it's also what we want you to do. So FAST stands for face. You look for somebody and see if they have some asymmetry of the face. If one side looks like it's drooping down, or it just doesn't look like it's the right equal amounts on both sides.
Does that kind of happen suddenly?
It can. And so all of these things you look to happen suddenly. Okay. So a sudden onset of any of these things is a stroke and thus proven otherwise.
Okay.
So the first one is F for fast. The next one is A, and that's for arm. So you either look for someone who can't lift an arm, and it can be either side of the body, or someone who lifts their arm and one of them may droop down like this. So that's a sign that they're having a stroke as well.
Okay. If their arms are just at their side, would you really know?
Well, if they're at the side, you ask them to lift them up, and so you ask them to lift both of them up.
So maybe you've noticed something with their face
That's
going on.
right.
Okay.
That's right. And so that's what usually happens is somebody looks over and sees something with their face, or what the S stands for is speech.
Okay.
And so if their speech is slurred, and as I said before, it's kind of like Otis the Town Drunk from Andy Griffith, right? So he walks through and he's talking with his weird slurs and all those things.
Right.
That's what you're looking for.
Weird slurs and they're not drunk.
That's right. That's right. Yeah, that's right. You have to make sure that they haven't been drinking wine or it wasn't Cinco de Mayo,
because that could cause all those other things too. So if they're not drinking.
That's right.
Yeah, serious signs.
That's right, serious signs. The other thing with speech, though, is that sometimes people can't understand what you're saying, or they can't even get a word out. So those would be things to look for S for speech.
Okay.
And then the T stands for time, really. And so time means we want you to understand what time it is and then call 911 immediately.
Okay.
It's important to note the time because some of our treatments are time sensitive. So for instance, there's a medicine we can only give up to 4.5 hours out, or there's some studies that are debating that now.
Okay.
And there's some other procedures that we can do as well that are sometimes time sensitive.
Okay, so FAST, and it's face, arm, speech, and time. So not only the acronym, but also be fast. Do we have a question? Something happening?
Yes. Are the symptoms the same for men and women?
Yes, they are. So this is not something that discriminates by gender, by ethnicity, by age. It's all the same. And, I tell people that if you see the symptoms in anyone, then you should act fast. And it's funny you said be fast, because be fast is the next piece because we've added the B in front. And be fast is because we want you to be fast, but also because some of these other signs were being listed. So the B, for instance, stands for balance. So getting back to Otis, that town drunk, if he's stumbling or somebody's stumbling there, then you definitely want to think about a stroke. And then the E stands for eyes. So if someone says they can't see to a side or they're having double vision, then that can be the sign of a stroke as well.
And is there something that might happen first, like on the first onset of a stroke happening?
Usually the things that people notice the most are someone whose face is drooping because that's something I can just look at you and see, or their words are slurring. But in honesty, any of these things can happen in first, or it depends on where the stroke is happening in the brain.
Okay. And again, we're talking about Stroke Awareness Month. This is Dr. Mark Murray. He's a stroke neurologist. I don't know if I said that earlier, but he knows what he's talking about. So ask us your questions and he can answer them. We have another one?
Yes. What happens if you live alone? Like, what can you do?
So the first thing to do is call 911 immediately. And that goes for even if you're not alone. A lot of times people want to bring people into the hospital, but there are things that the people with EMS can do that can really help us out and actually shorten the time to treatment. So if you're home alone or if you're with someone else, then I would suggest that you call 911.
Okay. Could something happen so fast you're not even able to get to the phone?
That can happen, and unfortunately when that happens, sometimes the people are found in their homes. Family members check on them and find them later, and that's a very unfortunate circumstance.
Right, that would be very scary.
If you start to feel anything, numbness even, sometimes the acute onset of numbness, then you should really start to call someone and call 911. What I tell everyone is that if it's a false alarm, we'd rather it be a false alarm and us find out it's a false alarm in the hospital.
Right.
We'd hate for it to be a real stroke and you'd be laying at home and it'd be too late for us to do something.
Right, because it is time sensitive. So better safe than sorry is probably more true than it is with a stroke.
That's right. There's one figure that says that every minute people lose almost 2 million brain cells. So it really is important to act fast.
And you're a stroke neurologist, so tell us a little bit about what your role is and what role you play if I was having a stroke and I came into the hospital.
So if you came in the hospital as a stroke neurologist, I kind of take care of everyone from the emergency department all the way up. So we meet you in the emergency department and we take care of you, do an examination on you, get some scans, because what we're looking for is we're talking about ischemic stroke. There's also a bleeding type stroke that we call a hemorrhagic stroke.
Okay.
The difference being that the ischemic stroke is where you have a blockage of a blood vessel. We want to differentiate those two, because if you have the blockage of a blood vessel, the one we're talking about here today, the ischemic one, then there's medicine, a particular medicine called IVTPA that we can give you that can help break that clot up that's causing the stroke.
Is that the more common type of stroke that someone would have?
It is the more common. That's the one that happens about 87% of the time. I like
Okay.
round numbers, so I say 85%.
Okay.
The bleeding type stroke only happens about 13 to 15% of the time. So that's the one we see the most. But we still need to get a scan of your head to make sure that it's not the bleeding stroke, because we don't want to give you a clot busting medicine if you're bleeding in your head.
Okay.
During the exam, giving you the medication, and then we admit you to the hospital to work out what may be the cause. And there can be several different causes, and that's one of the main things we do after giving the medicine, is that we look for the cause of the stroke so that we can make sure it doesn't happen again.
Okay. Do you have any more questions on Facebook?
We just have a comment from May May. She said she didn't have a lot of those symptoms, but they did have trouble remembering, such as favorite words, names, and spelling simple little words.
Yes, that's called aphasia, and that's the other part of S. So that's what I was talking about, where some people, they can't talk or they can't get words out correctly. Sometimes it's they can't talk at all, but they can understand you, so they can follow commands. Sometimes they can get a few broken words out.
Okay.
And there's another part of aphasia where people, they don't understand, but they can talk, but the words they say don't make any sense. And so again, that's another part of that FAST, which is the speech part. So it's not just the slurring of the words, but it's also not being able to speak and not being able to understand words at times.
Okay. We talked about stroke not discriminating, race, gender. What about age? I mean, I feel like you do hear of younger people sometimes having a stroke. Is there an age where it's more common, less common?
We like to say that it's more common in people over the age of 65. However, people can have it at a young age. The youngest patient I ever treated with a stroke, I treated a 7-year-old when I was in training, and I just recently treated a 17-year-old. Recently, 2 weeks ago.
7 and 17?
7 and 17.
Okay, wow. I thought you said 70 at first. I'm like,
No,
that was your youngest?
no.
Got it.
But yeah, so
Yeah,
2
that's
weeks ago we
scary.
treated a 17-year-old here. And there are different reasons why people may have a stroke. So in people who are over 65, the most common things are high blood pressure, high cholesterol, diabetes, sedentary lifestyle, bad diets, things like that. And that's why it's important to see your primary care provider, and why it's important to know your numbers, as you said earlier.
Right, know your numbers through 9 Health, get blood pressure checked at the 9 Health
That's
there,
right, that's
prevention
right.
measures that can be taken.
That's right. In younger people, sometimes they're more predisposed genetically, or there can be other things that can happen. They can get tears in blood vessels because they're active, they're playing sports and things like that, and can cause clots to go to their brain. So we look for all of those things when the patients come in.
Okay, and when they're seeing their primary care provider, what are some of the, warning signs? Is it just high cholesterol? Is it just high blood pressure? Is that when you should make changes to avoid a stroke?
Yeah, when you talk about prevention, 90% of strokes can be prevented. And that's one of the numbers we like to tell people. And you can prevent them by doing those things. See your primary care provider. Go in and get your numbers at 9 News, at the 9 Health Fair.
Yeah.
High blood pressure, high cholesterol, smoking, overindulgence in alcohol, all the things that your doctor tells you aren't good for everything else, including your
Right.
heart, they really are not good for your brain either, and so they
Okay.
can also cause strokes.
Okay. Do we have another question?
That's
See
just-
Kat's hand raising.
Yes, just a question about aspirin. Is it beneficial if you see signs, to take aspirin, or?
That's a great question. A lot of people have been told that if they have, feel a heart attack or feel symptoms of
Yeah, I
stroke,
was
to
gonna say,
take
I've
an
heard about it
aspirin.
with a heart attack.
So the reason we don't want you actually to do it with the stroke is that some people who have a stroke have problems swallowing, and if you take that aspirin down and it doesn't go down into your esophagus, which is what goes down to your stomach, so
Right.
your food pipe, it can go into your trachea, which is your windpipe, get in your lungs and can cause problems. So we'd rather you not give the aspirin initially so that we can make sure that the patient can swallow properly. We'll take care of all of that when they get to the hospital after we check them for those signs and
Okay.
symptoms.
And there's no prevention with aspirin, like taking aspirin to prevent strokes.
So we do actually.
Okay.
So when patients come in and have a stroke, we always put them on some kind of blood thinner.
Okay.
And one of the main ones we use is aspirin. And people say, well, aspirin, I use that for headaches. Well, aspirin
Right.
also helps to thin the blood and helps prevent some of the things that can cause stroke.
So if someone is at risk, is that something they should be taking daily, or is it
That's something you should talk to your primary care
Okay.
provider about. You know, we used to tell everybody over a certain age a long time ago to take an aspirin every day. We now realize that that's probably not reasonable, but there
Okay.
are some people that an aspirin a day is useful for. So you should talk to your primary care provider or your other health providers about that.
Okay, and another treatment measure, you said you perform procedures to remove clots from the brain. Talk about your other title, other role, and what that involves.
So I also do interventional neurology or neurointervention, and so what that entails is me taking a catheter up to the blood vessel in the leg and steering it up to the blood vessels in the brain.
All the way from your leg to your brain.
That's right. So we usually go right here. We tell
Okay.
people the groin, but you know when you tell them the groin, they have a different thought process. When you tell them the leg, the thigh,
Right.
really.
Okay.
And there's a blood vessel. We go in there, and it lets us steer everything up.
Wow.
I tell everybody I'm an East Coast guy, so it's kind of like the subway. You know, I get on here, but I get off up in the head. And so some people have what we call a large vessel occlusion, or a really big clot that's inside of the blood vessel in their brain.
Okay.
We can see that on some of those pictures I tell you we get in the emergency department.
Okay.
And if we see that, then we can pull it out. And as we talked about before, I kind of tell you that my uncles call me a fancy plumber, right? So if there's something clogged, I can unclog it. And so we have all these new devices that we can use. We can pull some of those clots out and restore blood flow. And if we do it fast enough, then you know we can decrease the amount of symptoms patients will have. And
Okay.
sometimes patients even walk out without any symptoms.
So when you come in and you're having a stroke, the first thing is to be scanned.
That's right.
And then if you see something like that where you could remove it, is that the next step?
That's the next step. That's
Okay.
correct. And we used to have time windows, but those are starting to go away a little bit now. So we can treat those at least up to 24 hours and even beyond now, depending on what the scans look like.
Okay, and I had written that it would be prevention measure before, but it's not really something
Yeah.
prevention-wise.
Yeah,
But
that-
if someone was getting a routine MRI and saw some clots in the brain, would you do that procedure?
Well, you know, that's a little different. If someone's getting a routine MRI and they see some clots in the brain, then they probably are already going to have some symptoms. You know,
Okay.
your brain really needs to have blood flow. So
Right.
if it doesn't have blood flow, it doesn't like it a lot. But there's some people who kind of get really narrow vessels up there, and that's a little different. And that happens over time, and they can compensate. But a new clot, something that pops up there, you're going to know because the symptoms are going to show up.
Right, okay. And tell us those symptoms again for people that have joined late, because
All
that's
right.
the most important part. And it's
That's
not just FAST acronym, but it's
That's right.
B FAST.
It's
So
be
tell us
fast.
everything again.
All right, so B is for balance.
Balance.
So walking around and they're falling down, or they're looking like they're going to fall down.
Okay.
The E is for eyes. So problem seeing, and here we're looking for problem seeing to a side, or you know problems with double vision or things like that.
Okay.
The F is for face. So looking for someone whose face just looks like it's not equal. So one side is down or one side looks up comparatively. A is for arms. So can they even lift their arm up? And if they can lift their arm up, and as I said, you want to lift both arms up together, does one of them drift down? Is one of them slower to lift? Can they not get one of them
Right.
up? The S is for speech. So slurred speech, or as someone on Facebook said, you know, also not being able to say words correctly or get any
Right.
words out or understand words.
Okay.
And then the T is the most important, is time. Note what time it is when you see the symptoms start, and then call 911 and get them in as fast as
So
possible.
yeah, even though it's scary if someone's having a stroke, look at the time so you can tell that to emergency responders and to people at the hospital.
That's right.
Do we have any other questions?
Yes.
Okay.
Is anxiety a risk factor for stroke, like anxiety or panic attacks?
So anxiety is not really a risk factor for stroke, but it can look like stroke. So people
Okay.
who have anxiety attacks can sometimes look like they're having strokes. They can sometimes have problems with speech or moving their limbs or their arms. It doesn't cause a stroke, but it's one of what we call the mimics of stroke. So something that can
Okay.
look like a stroke that we have to rule out, and that's one of the reasons why stroke neurologists would go to the emergency department and see that patient.
Okay, but still get that checked out. Like
Oh,
even
yeah,
if you suffer from
definitely.
anxiety and panic attacks.
That's right. It can be very crippling and very debilitating,
Right.
so you really need to get that checked out. You can talk to your primary care provider to start, and they may send you to a mental health provider as well.
Okay. Better safe than sorry if you're experiencing any of those B FAST
That's right.
symptoms.
That's right.
Okay, and then you also mentioned before we got on something about a stroke fair that you guys are doing.
Oh,
Talk
yeah.
about what that is.
So May is Stroke Awareness
Mm-hmm.
Month, and so a lot of the hospitals throughout Centura are doing things. So you can look at our Facebook page or other pages. But here at St. Anthony's Hospital on May 24th, we're having a big stroke fair. We're having the vendors come out. They make the devices that I pull clots out of the brain with, so they'll pretend
Come
to
take
play
a
with
look.
those. That's right. We have models where you can pull one out of a fake brain.
jeez.
Yeah, so we can see how good you do. We have to bring you back and see how fast
Right,
you
yeah,
are.
we'll have to come
We'll
back.
time you and see how fast
Come
you
back
do.
for the stroke fair.
We have that mega brain, which is the giant inflatable brain,
Right.
which has not only things that cause the blockage type strokes, the ischemic strokes, but aneurysms and things like that on it that you can walk through. And we have food and other things and prizes and other things to help you understand how to prevent stroke. So
Okay.
come on out and to St. Anthony's on the 24th.
On the
between
24th.
10 and 2, I think.
Okay, St. Anthony's on the 24th for the stroke fair, so everyone's welcome to come to that as well, because it's all about education and teaching people about strokes. So
That's
you're
right.
able to recognize those signs and symptoms very fast and get your loved one help, get yourself help, and
That's right.
yeah. Is there anything else that you wanted to add?
I think that's it. And if you think you're having any problems or anything else, like I said, always call your primary care provider. You can look up your local neurologists or stroke clinics, which we run here as well.
Okay.
And just make sure you remember those acronyms so we can get better
And
than
if
30%.
it's any of those the letters in the acronym, call 911.
That's right. Call 911.
Okay.